everyone. It is 6 o'clock, so we're going to try to get started right on time. Thank you so much for joining us for our 7th District Congressional Candidate Forum on Healthcare. Please sign in at the table at the front if you haven't already, and write your questions for the candidates on a note card. We'll be selecting several audience questions for the candidates to answer. My name is Winnie Lynn, and I'm a pediatrician and co-chair of the Illinois chapter of Physicians for a National Health Program, which is the main host for tonight's event. Physicians for a National Health Program, or PNHP, is an organization made up of physicians, medical students, and other health workers advocating for universal, comprehensive, single-payer national health insurance and collaborating with others to fight racism and advance social justice. On behalf of PNHP Illinois, I'd like to thank our 3 co-sponsors for tonight's event. The first is the People's Lobby, an organization devoted to organizing widespread support for legislation and candidates that put the needs of people and the planet before the interests of big corporations and the very rich. The second is Illinois Single Payer Coalition, a group of individuals and organizations throughout Illinois promoting a national single-payer healthcare financing system. And last but not least is National Nurses United, the largest union and professional association of registered nurses in U.S. history and a leading advocate for healthcare justice. Representatives from all of the sponsoring organizations will be present to answer questions after the event. I'd like to also give a big thank you to all the candidates attending tonight. To share a bit about how tonight's panel was assembled, we formed a planning committee to review every candidate running in this race. After looking at the full field, the committee agreed on using a fundraising threshold and viability criteria based on prior elections to guide invitations. These benchmarks helped us create a focused, manageable forum for meaningful conversation. We recognize and respect that many more individuals are running, and we regret that we weren't able to include every candidate. Our hope is that tonight's discussion still supports voters in learning more about the ideas shaping this race. As for the structure of tonight's event, first, I'll briefly discuss the healthcare context in the U.S., then I'll hand it over to our moderator for the main portion of the night, which is the Q&A with the candidates. After that, we'll ask the candidates some questions from the audience, so please fill out a note card if you haven't already. After the audience questions, we'll ask the candidates to deliver closing statements, and we'll end at 8 o'clock after some final remarks from our moderator. Now for some context of what's going on with healthcare in the U.S. Despite having exceptional medical resources, world-renowned hospitals, and spending more per person on healthcare than other developed countries, the U.S. has lower life expectancy and higher maternal and infant mortality than our peer nations. The reasons for this are complex, but it's important to consider the following. 28 million Americans are currently uninsured, and it is estimated that lack of insurance causes 45,000 preventable deaths each year. Given the impending Medicaid cuts and expiration of ACA subsidies, the number of uninsured Americans is expected to rise to 44 million in the next decade. And then there's the problem of underinsurance, which is what happens when people have insurance, but the out-of-pocket costs of healthcare, such as premiums, co-pays, and care that isn't covered, is unaffordable. The majority of bankruptcies in the U.S. are linked to medical debt, and 80% of those who went bankrupt have health insurance. Therefore, many Americans who have health insurance are not doing well, and the costs are only going up. But you know who is doing well? The health insurance companies. Private insurance firms have been making record profits, and the majority of their revenues now come from Medicare Advantage and Medicaid managed care plans, which have privatized delivery of public health insurance programs. These programs have been shown to raise taxpayers' costs. It is estimated in 2024 alone, Medicare paid Medicare Advantage plans $77 billion in overpayments compared to what it would have been spent under fully public Medicare. This business model relies on restricting access to care, and Medicare Advantage has been shown to worsen racial inequities in healthcare by disproportionately offering communities of color inferior insurance plans. Meanwhile, Trump wants to accelerate the privatization of Medicare, and the federal budget that he signed into law this year cuts $900 billion from Medicaid over the next 10 years to offset tax cuts for the wealthy. Of course, there's more to healthcare than health insurance. And as a pediatrician, I have to bring up the misinformation around vaccines that the current administration has propagated. And that has already resulted in increasing vaccine hesitancy and the resurgence of preventable infections like measles and whooping cough. The dismantling of public health infrastructure, the funding cuts for medical research, the weakening of nursing home safety standards, and so on, will all have devastating consequences for the health of our nation. So whoever wins this seat to represent Illinois 7 in Congress will face immense challenges, but also an incredible opportunity to reverse the course that we're on. We hope to hear some ideas from the candidates tonight about how they would use this opportunity. Now I'd like to introduce Dr. Monica Maloof, our moderator for tonight. Dr. Maloof is a physician and associate professor specializing in internal medicine. She's a delegate on the National Board of Physicians for National Health Program, as well as a member of the PNHP Illinois Chapter Board, and previously served as our chapter president. It was her idea to organize this forum tonight, and she's done most of the legwork of putting this all together, as well as a great team that we have today. So thank you, Monica, and I'll hand it over to you now.
Thank you, Dr. Lynn, and thank you to the outstanding team of volunteers and co-sponsor organizations who put in a lot of effort in making this panel come together. Lower this. So, just to set the stage, I have a list of questions for the candidates. And the first question we'll ask them, they'll get a minute to answer. Everything else, we'll have 90 seconds to answer. We have timekeepers in the front. I ask all candidates to please respect the time restraints, and I will not hesitate to cut you off if you go. I may ask follow-up questions. If I do ask you a follow-up question about your answer, I request that you keep that at about 30 seconds. And again, we'll have our timekeepers giving you a notification on that as well. For the audience, please, if you have questions, write them on the note card. There's note cards in the front. Dr. Lynn will be coming around in about an hour to collect those, and we will read the second portion. We'll read some audience questions for the candidates. So without further ado, I forgot to mention that I am going to kind of make sure that to start off each question, I will be starting with a different candidate for each question, just so you all are, there's equity in that practice. So to start off, I'm going to start with Dr. Boykin. I work with the Dr. Boykin. Candidate Boykin, and I'm going to ask the candidates to tell me in 1 minute, why are you running for this seat?
Testing. Good evening. I'm Attorney Richard Boykin, and I want to thank the sponsors of this healthcare forum tonight. Let me also thank my fellow candidates for being here. And thank all of you for taking time out of your schedules to be here tonight. I'm running for Congress to disrupt the status quo. Look, we've become two Americas. We have two American healthcare delivery systems, one for the wealthy and well-to-do and insured, and one for those who are poor and uninsured. Look, what we have right now is a crisis in the 7th District. In the 7th District, we have the largest life expectancy gap of any major city, and that's in West Garfield Park. There's a 20-year life expectancy gap, and that's just 7 stops from downtown. We have to change that. I'm running to do that. I'm Richard Boykin, and I look forward to being a part of this panel discussion. Thank you.
Thank you, everybody, for being here tonight. My name is Keena Collins, and I'm simply running for Congress because healthcare, housing, and dignity are rights, not just for the wealthy and the well-connected, but for everybody. And I'm from the west side of Chicago. My community is divested, underfunded, over-policed, and we deal with the systemic problems of what happened when people don't get proper health care. My start was as a national organizer with Physicians for a National Health Program. And it was taking on big corporations and training doctors and medical students on how to fight for a single-payer national healthcare program in America. And so I'm here tonight to talk about these issues. I'm glad to hear and see people are acknowledging the death gap that exists in Illinois 7, but it's not just going to be us electing a Democrat that's going to get this fixed. It's literally going to matter who that Democrat is. Thank you.
Good evening, everyone. I'm Anthony Driver Jr., and I am a labor leader and a commission president. So there's a number of reasons that I am in this race. The main one being that I am deeply impacted by gun violence, having lost so many friends and family members. But the main reason we're here today is for the number one issue facing our city, our state, our district, and our country, which is healthcare. And I'm not a person whose leadership started behind a podium. I'm a person whose leadership started on a picket line. And that was a moment that radicalized me in a way that I can't explain. Being a leader of a union that represents nursing home workers and seeing them out there during the pandemic, the same members who were just knocking on doors and organizing people to vote, then dying because the nursing home industry didn't afford them the same health care that they were providing to their members. And that was a moment when I knew that change was inevitable, that I had to push for change. And it was a moment that radicalized me in a way that I can't explain. And so this can't just be a safe Democratic seat. This can't be a placeholder seat. This has to be a seat that pushes the envelope forward, that organizes, that moves our city, our country, our state, and our district forward. Thank you.
Thank you. Now I can say Dr. Fisher.
I'm Dr. Thomas Fisher. I'm an emergency medicine physician on the south side of Chicago. I practice in the same community where I grew up. I'm glad to see all of these faces here to talk about healthcare because this is a healthcare election. I entered this race because after 20-something years taking care of people on the days that define their lives, I've learned a few things. First of all, when you provide care to people, you're a caregiver, this fundamental human process. You become a part of the fabric of a community. You also learn that people all have a shared humanity that deserves to be honored in the policies that we create. And third, you learn that the system is rigged, that people end up in the emergency department not because they have some genetic change, but because they do not have the same opportunity to be healthy and to get better once they're ill. I'm running in order to create an economy that honors our humanity, to create a healthcare system that provides for all, and to ensure that masked men that are roaming our streets, abducting our neighbors, are brought to heel. I'm Thomas Fisher.
I'm Deshaun Ford, and I'd like to say good evening. I'm running for Congress because I am a fighter for the dignity of Americans, a fighter for a righteous agenda, one that protects women, one that protects children, one that protects every citizen in this country, one that understands that healthcare is under attack, one that understands that the cost of living is too high, one that understands that housing, there's a shortage, one that understands that it is clear that college is out of reach for too many people, and we must have someone that understands how to go and fight to protect democracy in America. And healthcare is a major, major challenge in America. Not only is our democracy under attack, but healthcare is under attack. And I fight every day to save lives with this opioid crisis that is an international problem. And it's
Thank you, candidate Ford.
My name is Reed Showalter, and I'm running for Congress to lower the cost of housing, health care, and food, make it affordable and accessible. And the reason it's not affordable and accessible is because we've turned over the keys to the kingdom to giant corporate power for a generation. I've done this work at the national level already. I worked in Congress on the Judiciary Committee. I worked at the Federal Trade Commission and the DOJ, challenging the mergers that have bought up our hospital system and our healthcare system. And I worked in the White House National Economic Council, challenging the consolidation that makes everything unaffordable. We have a generational chance, not just in this election, but at this time in American history, to remake government into something that is exciting, that builds power for people, that actually delivers for them, not just for corporate power. For my part, in healthcare, that looks like passing Medicare for all. It looks like banning prior authorization. It looks like stopping the predatory capture and purchasing of our hospital systems and our healthcare systems by private equity and corporate raiders. We have a chance to fight for these, and it's important that we do because we need to return the American system to the people.
Thank you. You did it. So some of you have touched on this already, but the next question is, what do you think is the biggest crisis facing the American healthcare system today? I am going to start in reverse order, starting with you, Candidate Walter.
I don't think any of your
90
names-
seconds.
Sorry?
90 seconds on this question, sorry.
Sure. You'll not be surprised to hear that the crisis that I think is facing American healthcare is the fact that it is owned top to bottom by corporate power. That the people making the decisions about your care aren't doctors who have taken the Hippocratic Oath. They're investors who have a fiduciary responsibility to make as much money as possible. That doesn't need to be the case. In fact, it wasn't always like this. We had versions of this where 20, 30 years ago, it was illegal in most states for investors to own hospitals. Think about that. We can go back to that. There's a story that keeps me up nights. About a year ago, when I was working in the White House, I talked to a family who came in. They wanted to tell me a story about their son, Kyle. Kyle was an asthmatic, had been his entire life. And he went to the CVS one day, from sophomore year in college, to go get his prescription refilled. The CVS counter said, "We're not covering it today. We are going to charge you $700 for that inhaler." Something that costs pennies to make. And I was sitting with Kyle's parents because Kyle passed up on that inhaler, and several days later, Kyle passed away of an asthma attack. And I've looked in the eyes of Kyle's parents and parents across this district and the country and seen the pain of a healthcare system that is designed to maximize the opportunity for $700 more instead of a child's life, and that is disgusting and unacceptable.
Thank you.
So I would tell you the big ugly bill is the biggest threat to healthcare today. The fact that we realize that at the end of this month, people that own businesses will have their healthcare double, triple, quadruple because of the tax credit subsidy that will expire. That's a problem. The fact that we're going to now have redeterminations that will kick people off of their health care. They will lose their preventative care. They will be forced back into emergency rooms. People like me that survived cancer because I have health insurance may lose their lives. People that have asthma may lose their lives because they can't get their inhalers. Do you know that this big ugly bill says that individuals on Medicaid, if they remain on Medicaid, will have to go and now pay up to $780 a year for co-payments? That's ridiculous. We must reverse what's happening in America with healthcare. We were on the trajectory to do well. We're turning back the time under this administration. We must fight back and say no to this Republican regime that wants to kick people off of health care and transfer wealth in America.
Thank you.
I think the fundamental issue with healthcare is that it puts people and profit in tension. past 35 years, we've been trying to improve three main goals in healthcare: reducing cost, improving quality, broadening access, and for some, also want to improve equity. But when people in profit are in tension, all of these things get corrupted. I've taken care of patients who do not have insurance and need emergency surgery and have to spend hours on the phone identifying who will provide the services that they require. At one point, I worked in Gary, Indiana, the only hospital in that town, and would have to transfer people to Indianapolis or Chicago, well out of state, in order to get the services that they require. This also works the opposite way. People with money are often fall prey to unnecessary care simply to extract their dollars. These full-body MRIs are one sort of example where you're getting things you don't need but actually cause problems simply in order to extract profit. Until we recognize that it's people that matter, that taking care of one another is a fundamental goal of every society, and if we don't have a society that cares for one another, what is the point of our government? We have to take all of these middle people out of the healthcare system and return it to a person and their provider taking care of the illnesses that are required to get them back to the lives and communities that they require, that they want to return to, with profit not being the goal.
So, the biggest issue facing our country right now is healthcare. The biggest issue facing our district right now is healthcare. And while I'm happy that everyone is talking about access and affordability, and I do believe that that's at the core of the problem, I want to be clear. I think healthcare should be free, completely free. You shouldn't have to pay a dime. You got people going to emergency rooms when it's too late because they couldn't afford preventative care. You have people like my mother who had miscarriage after miscarriage after miscarriage, and her own doctor told her, "You're gonna kill yourself, knock it off. You can't have kids." And she just wouldn't quit. It was her dream to be a mother. And that's the reason why I'm an only child to this day. We have to take care of our own. Healthcare should be free. In your most vulnerable moments, the last thing you want to be thinking about is how am I going to pay for this? That is completely ridiculous. And so this is an issue that touches everything. I'm glad we're talking about cost, but one thing we need to call out specifically is the insurance industry. And when we talk about the insurance industry, we talk about profit. We not only have to rein them in, we have to ban anyone in the insurance industry from contributing to any political candidate. If you work in the financial industry, you can only give $250 to a political candidate. Yet the insurance industry, which literally has our lives in their hands right now, and is controlling the wheels of our government, is allowed unfettered access to spend millions of dollars on political races, to buy these races. So we have to make sure we pass Medicare for all, and we have to be more specific when we're talking about Medicare for all. And lastly, we have to ban anyone connected to the insurance industry from contributing to campaigns.
So everybody touched on the affordability issue, and other people talk about the moments that radicalized them in healthcare. When I was working at PNHP, they said it was too extreme to get a single payer healthcare program across the country. But that wasn't as extreme as the child that I met in North Lawndale who had type 1 diabetes, and they were rationing their insulin with them, their grandmother, and their grandfather because they couldn't afford it. What was extreme was the teachers that we met in San Diego and Pittsburgh who were scraping the bottom of their pockets to get school supplies for the students in their classrooms, but couldn't afford prescription drugs, rent, and food every month. So this is no longer just everybody knows that this is an affordability issue, especially here in the Illinois 7th Congressional District. My concern is a little bit tilted as we are in this administration. I think the biggest crisis we're facing right now is that our physicians are being threatened with criminalization for doing their jobs. Women who are seeking and people who can birth are seeking abortion care, and our physicians their hands are being tied on what they can do. We, as the voters and as residents, have to stand in solidarity with our healthcare workers, our nurses, and those who are frontline people who can protect our communities, to say that we need to allow them to do their job, and we're not going to allow the government to step in and hog-tie them in on that. Thank you.
Thank you.
I
think the biggest crisis facing our healthcare system today is the Trump administration. The cuts to Medicaid are gonna hurt a whole lot of people. The cuts to NIH research funding, the cuts to HHS, Health and Human Services, staff, the cuts to CDC, Centers for Disease Control. We won't be ready for the next pandemic, an infectious disease. The cuts to the Office of Minority Health, which actually is responsible for dealing with racial healthcare disparities that exist. This administration is hell-bent on cutting. And when all you do is cut, all you get is blood. And it's the blood of millions of people who've died prematurely that's flowing down the streets, and the blood is crying out. Who will speak for me? I will. I'm Richard Boykin. Thank you.
Thank you. Circle back to candidate Mayor Hoskins, who just arrived. And Lori, I'm going to give you 90 seconds to just say why you're running and what you think one of the biggest crises facing U.S. healthcare is today.
Good evening, everybody. My name is Rory Hoskins. Apologize for being a little bit late. I've served as Forest Park's mayor since 2019. And Forest Park today is a different community than it was before I became its mayor. My first term was characterized by the COVID pandemic. We made it through the COVID pandemic. Forest Park came out stronger. In my community, we located a COVID mass vaccination center near mass transit and allowed shots to get into people's arms. My second term, we've advocated for transit reform comprehensively. I was involved in standing up rider safety concerns. And now, as a result, the towns of Oak Park, Forest Park, and River Forest will be reimbursed by CTA for first responder costs at CTA property in those communities. Forest Park is a stronger community today. We stood up to Trump's excesses. We pushed back when they wrongfully detained workers in a Forest Park cemetery, American workers detained by ICE. What we're seeing now is they're trying to extort us with respect to federal grants. FEMA and the Department of Justice have come to Forest Park, and they've insisted that we promise to swear off DEI, to sell out our LGBTQ neighbors,
Thank you.
to cooperate with ICE, and to keep it secret when ICE is staging from our community. The answer is hell no.
Thank you all for those thoughtful answers. I know a lot of people touched on themes of affordability, access, and equity. We are going to talk more robustly about all of those things. But the next series of questions I have is just a raise your hand if you support. So please raise your hand if you support a woman's right to make her own decisions regarding her health care. The audience can participate too. Okay. For candidates and anyone in the audience who's interested, would you, as representative of our district, co-sponsor the Women's Health Protection Act as presented by Chu in the 119th Congress that would protect the right to access abortion care and provide legal protections against medically unnecessary state-level restrictions? Please raise your hand if you would co-sponsor this bill. Please raise your hand if you will support policies and policy changes to protect patients' abilities to pursue gender-affirming care as recommended by their medical teams and major medical organizations. Please raise your hand if you would vote in support of the Protecting Sensitive Locations Act, H.R. 1061, which restricts federal immigration actions in certain areas, including sensitive locations, including schools, hospitals, and places of worship. Okay. Please raise your hand if you support Medicare for All. Keep your hand raised. Please keep your hand raised if, as Representative Danny Davis did, you would co-sponsor HR 3421, the Medicare for All Act, as introduced by Representative Jayapal, which establishes a national health insurance program administered by HHS. Okay. Excellent. The next series of questions, as I said, will touch on issues of access, affordability, and the big beautiful bill, which I will, you from here on refer to as BBB, so I don't have to say that. I'm gonna just take turns with each question. I'm gonna start with a different candidate, kind of going down the line, and everyone will have 90 seconds to answer. I may ask a follow-up question based on what you say that you have 30 seconds to answer. So I'm actually gonna start this question to candidate Kina Collins. Kina, the BBB imposes more frequent Medicaid eligibility checks and work requirements. Conservative estimates indicate that Illinois could lose hundreds of thousands of enrollees. If elected, what concrete steps will you take to mitigate the impact of these redetermination and work requirement provisions, especially given how many residents in our district rely on Medicaid?
Yeah, such a great question. So first of all, I think that these work requirements are punitive and they're regressive to the people who really need the health care, particularly in communities like Illinois 7, where we have vulnerable populations of people that have either disabilities or they have unstable employment. And we are seeing a growing faction of our district take part and across the country in gig work like Uber and Lyft just to make ends meet. And so those requirements are nothing more than bureaucratic red tape that I would not support. I would vote down amendments and bills for that. And I would put a coalition together with the Attorney General's office here and in the state of Illinois, the governor's office, and any lawmakers to make sure that we're putting forth litigation to block those regressive blockages to give people access to healthcare.
Thank you. Candidate Bradley?
Yes, so when elected to Congress, I will absolutely fight to claw this back. But I also want to be clear that we're going to take the House next November. We can feel the energy. We know that the Democrats will retake the House of Representatives. But in the meantime, we have to insulate our communities. What are people doing right now to make sure that our communities are prepared for this? Are we educating one another? Are we hosting mutual aid? Are we talking to one another and making sure that folks know that this is coming? Because in the meantime, there's going to be a gap before we're sworn in. And that's where it requires organization. And that's what I do for a living. Every single day I'm organizing on behalf of 160,000 of our members, most of whom are home care and child care and nursing home workers, and making sure that not only they know what's coming down the line, but that they can tell their families, and each of us can hold each other and embrace one another during this time when we know these horrific cuts are coming. So we got to insulate our communities now, and we got to build for the future to make sure not only that we call it back, but that we put something in its place that's 10 times better than we have ever had.
This is a scam. Redetermination plans are designed to keep people who need health care from the services that they require. It penalizes poverty, it's punitive, and it's destructive. There are a few things that we can do in the meantime. The first thing we can do is in settings of clinical care, we have a lot of opportunity to do redetermination for patients, to help them fill out the forms that they need so that they get the retroactive care coverage and they can receive care in that moment. Those services exist in many emergency departments. They exist in clinics, and they can be expanded by both education and support of these healthcare settings. I agree that we will take the House, and in that time, we both need to rescind the big, beautiful bill, but even if you go back, care was terrible 10 years ago, 15 years ago. We actually need the sorts of bills that move forward to include, in the short term, ensuring that we don't have to go through these rescission wars again, but create a single-payer healthcare system that render all of this moot moving forward.
Well, this is important because we have the redetermination that will kick many people off of healthcare. We need to have a legislature that understands that we have to support HFS. so that HFS is better prepared to deal with this problem that's coming. HFS has to work with our medical teams. Everyone that touches a patient should be involved in making sure that these individuals are redetermined. We need auto redetermination for as many people as possible in Illinois. We have doctors that have the ability to help. We have pharmacists that have the ability to help with redetermination. And we have the MCOs that are very, very well funded in Illinois. Everyone, this is a collaboration that has to be put together. Not only the doctors in the medical field, but we have nonprofit organizations. We have anyone that touches a person that has Medicaid, like our DHS offices. It's a collaboration that must be all hands on deck, but it starts with the legislature making sure that it funds HFS to help with redetermination in Illinois.
I object to the work requirements, getting in the way of people getting their health care. Early in my career, I was a social worker, and I worked for a Head Start program serving the communities of Lawndale, Austin, and Garfield Park on the west side of Chicago. I worked with many families experiencing all kinds of stress, the most vulnerable families in the 7th District. And today, sometimes I'll look at Fox News to see what the other side is saying. And they frame the work requirement idea in terms of what they call reasonable work requirements. So first of all, I would, of course, like any Democrat on this stage, work with leadership to take the work requirements out of legislation so that people can get their health care. But as a member, I think there's something to be said for coalition building. I believe that there are good people in the Congress, even with an R behind their names. And as a member, I would bring them to this district. I would show them the people in this district. I would show them the communities in this district. And I would make it very clear to them the harm that they're doing, some of their draconian measures that they're injecting into the lives of Americans. So I believe there's coalition building, but then there's also work within our own party to make sure that everyone can get the health care they need.
I can't think of a better argument for Medicare for all than these types of requirements and redeterminations. There's a reason why the Republican Party continues to push cuts and bureaucratic hurdles like this, because the Medicaid programs, the Medicare programs are popular. People like them, people need them, people rely on them, and it shows that governments can do great things for people, things that people can rely on. This is the fight, I think, of this generation. And if we were to build power for Medicare for all, or lower the age for which you are eligible for this, or raise the age so a 26-year-old could stay on not just the parents' plan, but be eligible for Medicare as well, we start taking big bites out of the people who are being kicked off of this. Obviously, I would be fighting tooth and nail to make sure that we restore the funding and the programs that we need for the people who are currently on Medicaid. And more than that, we are going to see more people kicked off Medicaid. And where are they going to go? They're going to go to the private markets, where people just told me yesterday, there's a person I talked to yesterday who has a $20,000 deductible. They have to pay $20,000 out of their own pocket before any part of that insurance plan kicks in. And as we face draconian Republican cuts, more and more people are driven to a healthcare system like that, which can't be described as anything else but a racket and a scam. So we need to be fighting beyond just the four corners of bringing back this funding, but taking on the corporate giants who have made our healthcare system a racket and fighting to build power for Medicare for all.
I think that what we have is a rigged system. Don't start my time. Hold on, everybody. You start me over? Thank you. I think what we have here is a rigged system, and it's rigged against those who are the poorest of the poor. And I said that at the beginning. We have two Americas. An America for the wealthy, an America for the poor. And unfortunately, we have to become one America so that we can bring everybody together. President Trump and his administration are hell-bent on destroying our healthcare system. They hate the Affordable Care Act with a passion, and they want to destroy the whole system. And in doing so, it will destroy this country. Because healthcare right now accounts for about 18% of the gross domestic product. I mean, we're spending a whole lot of money on healthcare, but we got to make sure that people are well and alive, that they can do the work that God has called them to do. The reality of it is this, is that you can deny them healthcare, and that's the cruelest form of injustice. But the real deal is they're going to go to the emergency room and get healthcare. And guess who's going to pay the price? Everybody in this room. All of us, we going to pay because they can't go to a community health center and get their healthcare. And so I want to repeal the big lousy bill. I want to make sure that we expand federally qualified community health centers. I know a little bit about it. I serve on the board at the University of Illinois, Miles Square. Thank you all so much. Thank you.
Before I get to the next question, just for the audience, if you had time to write a question on a note card, please pass them to the center aisle. Dr. Lynn will come around and collect your questions to be asked later on. For the next question, I'm going to start with candidate driver. As you're all aware, the 7th district is very diverse, not just racially, ethnically, but also socioeconomically. 40% of the district identifies as Black, 18% as Hispanic, more than 15% lives below the federal poverty line, and more than 15% makes over $200,000 a year. Recognizing that Black and Brown patients often have challenges accessing healthcare, and within our district that there are huge gaps in healthcare outcomes based on race and socioeconomic status, what will you do as a representative in Congress to advocate for health equity in our district?
Yes, and this is a question that I can really appreciate, because it's a question that impacts all of us. This is a very diverse district. We have to use every single tool in our tool belt to fight back. And what that means is every single piece of legislation that we pass, if it's healthcare related or not, should have research funding tied to it. I just told you all a story about my mom, how she had back-to-back miscarriages that eventually led my parents to divorce. When we are passing healthcare bills, we have to ensure that there's money to research the Black maternal health crisis in that bill, and that there's things tied to it to ensure that we fix these health disparities. And I also want to address one more thing. All of us up here agree that we need to fight back. But what we're not saying is how do we fight back better? And that's what I want to talk about. That's why I'm in this race. If it wasn't for that, any one of my opponents would probably all be safe blue Democratic votes. But when I talk about fighting back better, I'm talking about the fact that this is one of the bluest states in the country. 15 out of 17 Congress people in this state are Democrats. Can anybody in this room tell me what all 15 of them stand for? Where's the Illinois coalition? Why are we not moving as a block? So yes, I support Medicare for all. But when elected to Congress, as I'm already doing, I need to organize, and we as a community need to organize all 15 of our Democratic members to push for one goal. Our folks aren't even talking to each other. Illinois needs to move as a block. We need to put a megaphone on this issue and ensure that we're addressing these crises in our communities.
Health inequity is a scourge. It is both the reason America doesn't have the longest life expectancy, it's the reason West Garfield Park and Streeterville have a 20-year life expectancy difference, and it's the reason why Black patients are more likely to die after a heart attack than white patients. It's the reason Black women are more likely to die after childbirth. It's the reason Black women are more likely to die of breast cancer. It comes from at least a number of things. Some of it is just frank racism. We live in a society that doesn't recognize our shared humanity and doesn't give us equal value. It also comes from things like just benign neglect and the pursuit of profit. The same reason that certain patients are unable to get a job despite a similar preparation for those jobs often leave people without health insurance, and therefore they don't have the resources available to them to get well once they get sick. There aren't clinics on the west side or south side, so they come to the emergency department. I often end up diagnosing cancer in the emergency department at a late stage and then have nowhere to send them for care. We end this in a couple of ways. One, we pay for those clinics and hospitals that are actually able to reduce inequities within their system. We make them measure it, and those that get better get higher payments, those that get worse get less payments. I did some of this work while I worked at HHS and delivered the 2010 National Action Plan for Health and Equity, but we never finished it because we never got started. Let's get started this time for real.
Thank you, candidate. Actually, I didn't ask a follow-up question. So you propose in there outcomes-based reimbursements to clinics. Can you elaborate on why you think that reimbursements should be tied to outcomes?
We've tried a number of times to try to pay, to get what we pay for. Right now, we pay for a lot of care, just extra units. We've been trying to align it to better outcomes. And it's not enough to just have better outcomes, it has to be better outcomes for everybody. If you are insured or uninsured, you should have the same sort of outcomes if you go to these medical centers, and we shouldn't prioritize VIPs over regular people. Unless you, the only way to ensure that happens is by penalizing those institutions that do.
Thank you.
So, this is a good time to say, could you repeat the question?
Thank you. So the question was, I summarized the demographics of our district, and I asked, what will you specifically do to help reduce health inequities in our district?
Okay, I mean, it's clear that the reimbursement rates in the communities where the highest need is too low. We need someone that could go to Washington and understand the fight to bring more money back to the Illinois budget so that we can fund our FQACs, fund our safety nets, so that they have what they need to actually serve the individuals that they represent. Plus, you have to understand that the federal government and the state of Illinois has always had a strong partnership into this administration. And now we see that we have to do everything that we can to protect what we have. We have to protect what we have so that we can stop people from falling off the road. So it's very important that we have someone that could go to Congress to fight to bring more federal dollars back to support FQACs and safety nets, and that understand how to bring money back for behavioral health for these hospitals and these safety nets, or FQACs and safety nets. Behavioral health is important for medical doctors. They have patients that they see with their physical health, but they also need to make sure that they can provide mental health support for them as well. So thank you.
So in Forest Park, we're always looking to bring healthcare options to this community. Our location is blessed by geography. So when I'm going to Congress, I will focus on directing funding for healthcare facilities near transit modes. We have Blue Line Inns in Forest Park, we have the Green Line Inns in Forest Park, we have Roosevelt Road. Right now, we're working with a major healthcare provider that wants to set up a satellite location in Forest Park. We're using our TIFs along Roosevelt Road to make it affordable for them to locate into our community. We have a diverse community. It mirrors the 7th district in terms of diversity. We have haves, we have have-nots. And some of the work that I've done recently around transit, I've learned of grant programs to incentivize the building of fire departments near transit modes. I'd like to see the same kind of grants support the construction of quality healthcare facilities near transit modes.
The health inequities in this district and across the country tell a story that all of us already know. It's that America has, for generations, bound up its racism and its classism in one neat and devastating package. And so the fight that we need to bring is to make sure that we are making healthcare universally accessible. There should be no gradation of, are you wealthy? Do you have a good job? Are you working for the government? Are you able to get healthcare from one of the few places where we have access to wealth in this country, or otherwise are you left to languish? And it's one of the reasons why when I talk about fighting for Medicare for all, I talk about it more broadly than that. Because Having Medicare for all isn't going to solve this problem of access. We need a full industrial policy push here. Making sure that we are building more clinics, training more nurses and doctors, making sure that people have access to the quality care that they need near to them, 5 minutes, 10 minutes away, in the communities that they grow up with culturally appropriate care. That is a jobs program. That's an infrastructure push. And there's real opportunities to build coalitions in Congress around that, not just to say we're going to have universal single care, but we're going to do at the national level a program that builds new hospitals, that builds new community clinics, that trains more doctors, and gets all of those built in the places that need them most.
In order to attack. I already know. In order to attack the issue of health equity, we must seriously attack the social determinants of health. The reality of it is that you look in Austin, you look in East and West Garfield, you look in Lawndale, you look in Inglewood, you look in Maywood, you got serious housing issues. You got people sleeping under bridges and viaducts. You got veterans sleeping under viaducts. That's wrong in this country. And you got kids who are food insecure. What does that mean? They don't have enough food to eat. They don't have enough fresh fruits and vegetables. I was in West Garfield Park. They don't even have a walkable grocery store. They use a dollar store or a Dollar Tree as their grocery store. Many of the folks in Austin, and you all know it, they come here to Oak Park to go shopping. They shop at Pete's and they shop at Jewel. And their tax dollars are flying out of Austin, flying into Oak Park. How is that helping to stabilize their community? And we got food deserts, we got job deserts, and we got pharmacy deserts. We got to deal with the social determinants of health. And when we deal with the social determinants of health, we will get some equity. And when you get some equity in health access, you will get help, you will get equity in outcomes. And so that's what we got to do. That's how we fix it. Now look, a lot of people have been around a long time. They talk this tough talk, but they haven't solved the problems yet. And so let's get busy solving the problem. Thank you all so much.
Thank you. Actually, we can ask you a follow-up question as well. Again, what do you see as your role in Congress in combating some of those social determinants of health?
Well, one, you got to make sure that you got the research on them, right? You got to make sure this administration wants to erase history. They want to erase research. They don't want you to deal with any research in terms of health disparities, because research drives policy. And if you don't have the data, you can't drive the policy. And so we got to make sure that we put the money back in to fund the Office of Minority Health. We got to make sure that we got going after these health disparities. It's wrong that African Americans actually suffer disproportionately heart disease, diabetes, high blood pressure, breast cancer, prostate cancer, you name it.
Thank you,
We suffer
Candidate Boykin.
disproportionately.
Thank you.
And that's wrong. Thank you.
Thank you, Tina.
Richard Boykin lost some time and then found some time. So this is something that some of you know I ran against Representative Davis, and healthcare was the #1 issue that voters wanted to talk about. And so what my team came up with is that in our first 100 days in office, we're gonna create a healthcare and life expectancy task force comprised of members of the Illinois 7, which includes students, organizers, activists, physicians, environmentalists, elected officials, to help measure. We can't change what we can't measure, so we have to measure that, right? That coalition within our district, which is a very strong case that we can make in Congress about a crisis that's happening in Illinois 7, they need to do the local work with elected officials as we're tied up with this lunatic in the White House right now. So our city budgets and our state budgets are our moral documents. We need to be making sure that we're fighting. We got money for everything else. And we know that in Congress, we got money to go to war, we got money for tax breaks for billionaires, and on the municipal level, we have money to over-police these communities. So then we should also be having the money to make sure that people are getting proper health care. And to answer the question about how do you combat outcomes as a congressperson. I'm the only woman standing up here, and the gentlemen who are up here on this stage have more bodily autonomy and rights than I do as a woman when it comes to healthcare. It is easier for them to get Viagra, for example, in all 50 states than it is for us to get IUDs and birth control.
Thank you.
That is outrageous, and we have to change that.
Thank you. I'm gonna ask the next question about coalition building. We're gonna start with Dr. Fisher. So a lot of you have mentioned pushing forward Medicare for all, rethinking reimbursement models for Medicaid. To get that work done, you're all hitting on something, which is the ability to build a coalition to make that successful. So how do you envision yourself pushing forward, having Medicare for all, which was once a fringe idea, but now is a central idea of the Democratic Party, a more central idea. How do you envision yourself successfully advocating for Medicare for all? And can you give us an example of a time where you've successfully built coalitions or teamwork to push things forward? I'm going to start with you, Dr. Fisher.
Thanks. The upside is when you tear apart these fundamental resources that everybody needs, there's an opportunity to build brand new things in ways that you rarely see when people are just barely moving forward together. Last year, we saw a United Health Group CEO get shot dead in the middle of Manhattan, and I, of course, abhor murder and think violence is wrong. And in that moment, the world cheered. America cheered for this. Because whether or not you're middle class or poor, everybody is dissatisfied with the health care that they're receiving because they do not trust the quality that they receive. It's way too expensive for them, and they have the inability to get it when they need it somewhere close to them. When physicians, nurses, pharmacists, and other healthcare providers start to lead a charge towards the healthcare system of the future, they have the opportunity to galvanize communities towards building towards something brand new. Medicare for All was fringe a decade ago. Now it's mainstream. People are ready for this sort of change. I had an episode at the University of Chicago when I was a young attending where these profit versus people initiatives came to a head. And we organized all of the nurses, social workers, and physicians to oppose a strategy that would build a wall in the middle of the emergency department for the people with insurance versus those without. Not only did we win and create an emergency department that prioritized by illness, we also ended up having the entire C-suite exited.
Thank you.
I'm ready for this fight.
Well, I would say that I was a Bernie Sanders delegate, so before the fight for Obamacare, I believe that we should have health care for all under Bernie Sanders as a delegate for him. And as a state legislator, I actually chief co-sponsored single payer. I understand the need to have a healthcare system in America that everyone can afford to have access to, no matter what their zip code is. It's good for America, it's good for every community, and we must have health care that's affordable for everyone in America. Did that answer your question?
Well, can you give us an example of a time you've successfully built a coalition, especially maybe in your role as a state rep?
Yeah, I would tell you, if you look at I don't remember the bill number, but I definitely chief co-sponsored single payer in Illinois over the years to make sure that we have the ability to have single payer in America. That's a great form of on the record that proves that I understand the need that every person in America deserves health care because it's a human right. I don't know if anyone else could say that they have chief sponsored any legislation up here, but I have. And for the record, I would like to make sure that it's recognized that we do have a grocery store in Austin, 40 acres. That's very important to put on the record.
Thank you. Candidate, if you want to answer a question about coalition building and how you envision yourself pushing forward legislation.
So I was first elected I've only served locally in Forest Park. I was first elected in 2007. I was the first person of color ever elected to any role in Forest Park. On the local level, it's non-partisan, but I served on the 5-member council were 4 Republicans who did not look like it. Okay, so that required a lot of conversations, it required a lot of relationship building, and eventually I got them to do things that I wanted them to do. Now, you may not know this, but Forest Park created this little tradition that no one had heard of called Juneteenth, right? This was in 2009. Forest Park was the first community in the west suburbs to even remotely recognize Juneteenth. People didn't know what it was. I'm from the South. I introduced them. I talked with my neighbors. I explained the history of this country in a way that black people have been treated for over 240-something years, enslaved. Eventually, people accepted that it was a realistic thing to celebrate. It spread through several communities, and today it's a national holiday. Now, I don't take credit for making it a national holiday, but I do take credit for bringing it to this part of the world and to influence in Illinois. So can I build coalitions? Yes. We all want to see health care for all. We all want to see effective, affordable health care. We live in an incredibly polarized community.
Thank you, Mayor Hoskins.
Can we bring us together? I believe I can.
Thank you.
I think there's two really important things about coalition building. And it's vision setting and actually taking steps towards that vision. Part of the reason why I'm banging on over and over up here for Medicare for All and big industrial policy is you don't get those discussions going mainstream by nibbling around the edges with small reforms. You champion every day so that the discussion is Medicare for All and industrial policy to make sure that we have equitable health access. But that doesn't mean that we can't do the work leading up to that. I've done this work at the national level already. I worked in the House Judiciary Committee. I worked at the DOJ leading our legislative efforts for antitrust and competition policy. And while I was in both of those roles, I worked on a bill that expanded funding for both of the antitrust agencies. And since then, that bill passed with my work at the Department of Justice. And the funding for that bill has since manifested in 36 challenges to healthcare consolidation by major insurers trying to buy up hospital systems around this country. This is the work that we can keep doing. And I'm not interested in small nibbles around the edges here. If we are going to do this coalitional work, we exclusively need to be doing the work that gets us towards the goal of Medicare for All and large industrial policy that builds clinics and hospitals in our state, in our district, and around the country.
Is that your mic this time?
Let me tell you, coalition building is most essential. It's the most important thing we can do. I'm a bridge builder. The name of my law firm is Bridge Builders, Legal and Consulting Services. Glad to see my friend Joe Smith here. Look, when I was on the county board, I did at least 3 things where we required coalitions. I led the effort to get rid of the awful, regressive soda pop tax. It wasn't just soda pop. It was Gatorade, it was orange juice, it was apple juice, any juices. It was diet sodas. I got rid of it. And I paid a heck of a political price for it. You can go look it up. And not just that, but I also got rid of the tax on feminine hygiene products. Some man thought it was the wise thing to do to put a tax on feminine hygiene products. Well, Richard Boykin got rid of it. We called it a medical issue for women. We got rid of it. And then, of course, the state followed suit after the county did. We led first. And then not just that, but we also was the co-chair with the city of an opioid task force. And Rahm Emanuel was the mayor. And we wound up bringing millions of dollars in resources to help deal with the opioid crisis on the south and west sides of Chicago. And we saved lives in the process. Those are 3 things, 3 ways in which we built coalitions. I want to go to Washington, be your voice, and do the same thing in Washington. Thank you.
So in 2017, Donald Trump was in his first term as a president, and he made a vow to eliminate reproductive health care across the country. So me and Maria Mozafar, we co-drafted the Illinois Council on Women and Girls, which is House Bill 5544. And in that legislation, we talked about creating a council that directly impacted or advised the governor and state lawmakers on any public policy that directly impacted women and girls, non-binary and trans folks across the state of Illinois. The only caveat was there was a gentleman who was a governor at the time, if y'all remember him, Bruce Rauner. And everybody said, Keena, there's no way that Bruce Rauner is gonna sign this bill into law. Our bill went to committee, and the Republicans in that committee said, if you all want us to pass this bill out of the committee, you need to remove the transgender protections. And my response was not without a fight. If you want to vote against the trans community, then let your record reflect that. I traveled to 68 counties out of 102 in the state of Illinois, building a coalition of Democratic women, Republican women, business owners, and civilians. Long story short, the bill passed in the House, it passed in the Senate, and Bruce Rauner was forced to sign that bill into law. They lost and we won. And that is the type of coalition building that I'm gonna bring to Washington, D.C. People ask me what type of committee I wanna sit on. I built a committee in the Illinois State Legislature. And that's the type of leadership I'll have in D.C.
Actually, I do have a follow-up question for you. In the comments that you mentioned, the work you did on the Illinois Council on Women and Girls, can you tell us what that looks like now reflecting back? What can you reflect on the successes or possible challenges that this act?
Yeah, that's a really great question. That initiative sits in Lieutenant Governor Juliana Stratton's office now. The Lieutenant Governor serves as the chair. They went on to build out more councils for young girls in different high schools across the state. We codified more reproductive freedoms through the Illinois Council on Women and Girls, making Illinois a safe haven. And that work extended back here to the city of Chicago, where the Chicago Status on Women and Girls was created by City Clerk Anna Valencia, which I also sat on.
Thank you.
You all hear me? So this is what I do. I'm a labor leader. I'm a political organizer. I'm a commission president. Building winning coalitions is at the core of my work. Just a snippet of the work that I've been able to do. I was the lead organizer on raising the minimum wage to $15 an hour. That was a coalition of over 250,000 Chicagoans that came together.
Right.
I was one of the lead organizers on paid leave for all that we just passed a year and a half ago, to make sure that everybody has at least 10 paid sick days, 5 vacation, and 5 sick days, no matter what. I was the lead organizer who literally helped to change the form of government in Chicago when everybody said it would never work. No mayor will ever give up the power to appoint their own police superintendent. The police department would only be accountable to the mayor. And we said the police department must be accountable to the people. So we organized and we built a winning coalition. That one was 150,000 people, over 17 labor unions, over 90 organizations that came together to say that the police department in Chicago has to be accountable to the people. And I was also the person who said, if and when I'm elected president, I will eliminate our gang database. And we got that done on day one, and we've seen better outcomes because of it. And that was before ICE and CBP were attacking our communities. That was 3 years ago when we did that. And lastly, let me tell you about the coalition that we're building right now. A coalition within this campaign that's been endorsed by 37 different elected officials and labor organizations and faith leaders. A coalition that's growing every day that has over 2,500 donors. People just like us. This campaign will not be about an individual. It's not me, it's we. It's us in this room. That's the most important endorsement. That's the most important thing, is partnership.
Actually, I have a follow-up question for you, since you brought it up, Candidate Driver. The elimination of the gang database, as that does, I think, tie into healthcare, and especially as we think about gun violence. Can you talk to us about your motivations for pushing for the elimination of the gang database?
Yes, in 2018, I took my father to a concealed carry class for Father's Day to bond with him. He applied for his concealed carry license. I didn't want to do that. He applied, he was rejected because he was labeled a gangster disciple, even though he had no felonies, no convictions, no visible tattoos, never been in the gang. Over 130,000 people were on that database. 90% of them black and brown males. The oldest person, over 10 people over the age of 116 years old, and the youngest person on the database is 7 years old. Denied employment at any state, federal, city, park district, CTA, sister agency, you name it, you were not allowed to be employed there. And so that was something that was really impacting our communities, and I'm proud to have eliminated it on day one.
Thank you.
Did you answer? Oh, we started. Yes, thank you. Okay, the next series of questions I have are all related to the growing rampant privatization of healthcare. I'm going to make just a quick last announcement about questions. If you have a question card that you still want to submit to Dr. Lynn, please just raise your hand. She'll come and grab it from you. Okay, so the next question is specific. We're going to start with Representative Ford, is about Medicare Advantage. Medicare Advantage enrollment continues to grow, and concerns have been raised about overbilling, care denials, fraud allegations, and the gradual shift of Medicare towards privatized models. What specific actions would you take in Congress to ensure that Medicare remains robust, transparent, and free from profit-driven motives at the expense of patient care?
Well, we need to make sure that we protect traditional Medicare. That's important, to make sure that we eliminate as much as we can the waste, fraud, and abuse in the system. I'm not saying that there's what you call criminal activity going on, but there is a lot of waste that's going on in this system that we could put back and strengthen our traditional Medicare. So my goal would be to make sure that we secure and stabilize and grow our Medicare system. Too much money is going into the Advantage, which could be put into strengthening Medicare. You know, I talked to people, literally today I got a call from a person that actually was denied because they needed to go to one of the big hospitals, but because they had an Advantage program in their Medicare, they were denied access. That was one call that I had today. Last week I got a call from another guy that I hadn't seen or heard from in years, but because he's in a Advantage program, he was denied access to health care, a life-threatening procedure that he needed. And so we have to strengthen Medicare in America and stop expanding the Advantage program, because it's a trick to many. Many people think that they're going to have a better outcomes, but it's not.
Thank you.
We have to protect traditional Medicare. We want to make healthcare available to as many people as we can, period. Now I work as an attorney in an insurance regulatory setting. And one of the companies that I worked with over the last several years was a former healthcare co-op created under the Obamacare, or Affordable Care Act. So I got to work firsthand with some of the pharma benefit managers who had been denying care or making other mistakes and kind of clogging up the system. So my job was to make sure that people were actually getting proper credit for payments that they had made and clearing up the work of these private entities that were causing problems with these healthcare companies. But we don't throw out the public model because there are some private entities who are pursuing profit for unscrupulous reasons and otherwise causing problems. Now, in terms of my public service in Forest Park, we have fought efforts towards privatization of care. In the Forest Park Fire Department, we used to contract with a company called Superior Ambulance. They provide paramedic services. We ended the contract with Superior as soon as I got reelected, and we brought those paramedic jobs in-house. They're now occupied by union workers with local expertise.
Thank you.
And Forest Parkers are better for it.
Medicare Advantage enrollment grows every year, and it's an open secret why. It's because we fund it $100 billion more than traditional Medicare. It's no surprise that when you pour hundreds of billions of dollars into a private system in order to pad their profit lines, then you can get people to roll into that system. But that is why, still to this day, the United States, across all of its systems, pays twice as much for healthcare and gets as good or worse outcomes as our developed peers. We need to fight tooth and nail against the privatization and the corporatization of our healthcare at every level of this chain. Medicare Advantage is just one example. Now, there are supposed to be laws that say that an insurer, for example, types of insurers on a Medicare Advantage plan can't make more than roughly 15% profit on those plans. Except we've allowed those insurers also to buy up all of the hospitals, to buy up the PBMs, to buy up every part of the healthcare system. And now, once you own every part of that, you can shift your costs. You can say, maybe we won't make 15% on the insurance plan, but we're going to charge people an arm and a leg for their pharmaceutical drugs. I'm sure many of the people in this room have watched as the deductibles for their drugs have gone through the roofs. They've watched as it's become harder and harder to get access to care and book an appointment. And all of this is because we have a corporatized system, not a public system designed to deliver care. So the more we watch Medicare Advantage and programs like that rip through our healthcare system, we will see continued results like we've seen before.
Thank you. Thank you.
I'm surprised nobody mentioned it. But as a congressman, you have the authority to hold hearings, to call hearings, to bring people before you and hold them accountable. And so what we're gonna do with respect to the Medicare program, we're gonna strengthen it. We're gonna expand it. We're gonna make sure that those pharmacy benefit managers who may be rigging the system and putting profits over people, we're gonna make sure we hold them accountable. We're gonna hold those corporate executives accountable at those insurance companies. We're gonna call them in. We're gonna have hearings that are gonna be televised, not just on C-SPAN, but everybody's gonna get them nationwide, so that we can make sure that we have a Medicare system that everybody can be proud of. And we're gonna expand Medicare for all. We're gonna make sure that everybody has access to that great health care. And especially people who live in the 7th District. In those communities where you have food deserts, where you have pharmacy deserts, where you have job deserts. And if I didn't mention this earlier, in Austin, Garfield, Lawndale, and Inglewood, they have Great Depression levels of unemployment. Over 40% of people unemployed. People have stopped looking for jobs. So that's what we gotta do. Thank you.
I think this is just a commitment statement because everybody is saying the same thing. Medicare was put into place so that our elders would have an ability to age gracefully and have access to health care. That is being hollowed out by privatization. So beyond what we need to do in holding business corporations and corporations in themselves and private insurance accountable is we need to have an elected official who supports ending Citizens United, right? So by doing that, we actually codify and put into law how we take big money out of politics. We could do a great talk and we could bring people forward in hearings, which I actually agree with, auditing and making sure that we know and holding people accountable and penalizing them for overbilling. But the core to all of this is that it's corruption. The biggest issue we have in Washington, D.C. is corruption. Giant corporations that have our government by the throat, and they are not letting go. And so if we do not end Citizens United, this is going to continue to happen, and I think that that is a bipartisan effort that could happen on both sides, where we run candidates and elected officials who reject corporate PAC money.
So I agree. We need aggressive oversight, we need quarterly audits, and we need to make sure that the insurance industry isn't running our healthcare. So as candidate Collins said, people up here are saying the same things, and I agree. However, we have to go a step further. Politicians are selling out our communities over and over and over again. If you work in the insurance industry, as I said earlier, you should be banned completely from giving to any political candidate. It is completely ridiculous that you have large insurance companies who have monopolized exploitation. And every candidate up here should agree on day one that you will co-sponsor a bill to ban the insurance industry from contributing to these campaigns. This is why I say the people closest to the pain have to be closest to the power. The people closest to the pain have to be closest to the promise that this country, this district, this state has said that it will live up to. This is an issue that I know very well. I'm a caretaker for my grandmother, and I have watched her struggle. I have watched her enroll, and I have watched her not be able to have a hearing aid. I've watched her during the pandemic when she didn't have hearing aids, and I bought her an Alexa device to be able to video chat with her, but she can't hear me because she doesn't have a hearing aid. Well, we struggled to communicate during the pandemic. I've watched the tears of our members who've been exploited in the nursing home industry, and the same people who they were providing care for, they then will go and die of COVID because that same industry wouldn't take care of them. It's time out for putting profit in politics.
Thank you.
People love Medicare. They love it. Not only is everybody on this stage in favor of extending it to everyone, but Medicare does all kinds of things that aren't obvious. They pay for residency training, so all new doctors get paid for by Medicare. The reason people are moving over to MA is, one, we're funneling money to them, as Reed mentioned, but the other reason is Medicare is expensive. Right? There is a very high deductible before they start paying for your care. There is a high copay once you start getting care, and there's no lifetime maximum. People on Medicare are either forced to get co-insurance alongside it or risk going bankrupt. And so for people who are already struggling to get by because housing is unstable and food is expensive, MA is kind of an attractive, appealing alternative because they know the maximum they're going to pay every month. That's the reason we need to bolster Medicare. We need to reduce the deductible. So for example, Medicaid has no deductible. It is first dollar coverage. You go in, you get covered. We need that for Medicare. We need lifetime maximum so that people don't get bankrupted with insurance. We need to get rid of these co-pays, and we need to start paying for many of the things that people need who are elders and don't have them, like durable medical equipment, hearing aids, eyeglasses, all of the things that are required in order to stay healthy as you age. We can bolster those things in Medicare now and stop people having to go to the private sector.
Thank you.
I'm gonna ask one more question, and then we'll pivot to audience questions. So I'm gonna start with candidate Hoskins. So we are living in an era of vast misinformation. We have seen the heads of this regime, the heads of HHS, repeatedly propagate false scientific information that threatens the lives of all Americans. What role do you see for Congress in combating misinformation and holding our cabinet leaders to account?
First, Congress has to want to do the job, right? Congress has to want to assert its authority and act independently. And that's not something that we're seeing right now. I've talked a lot about coalition building. I've talked about my own personal journey as a public servant. I worked in a setting, and I continue to work in a setting where most people just do not look like me, right? But you build relationships, you develop trust. Hopefully, you can agree on truth and agree on a few facts. Because what the Trump administration is doing to this country is absolutely terrible. I watch what they're doing to NIH. I watch what they're doing through Health and Human Services. And it tears me apart. I have 4 children. I was a graduate school of social work. I was a graduate student in social work when I became a parent in the mid-90s. Within 4 years, we had 3 kids. What saved us is a reliable, safe healthcare system. I want to see that for everybody. And I also have a daughter. And when they attacked reproductive care, Forest Park passed a resolution affirming right to reproductive care for women in America. I want to see my daughter have the same rights as every woman in this room has had for most of their adult lives. Healthcare is important. We're all Democrats. We're horrified at what the
Thank you, Rory.
administration is doing and the BS that they're propagating.
This is one of those rare instances where misinformation isn't just a story of online filter bubbles and your community. When you have cabinet secretaries speaking confidently and spreading misinformation about whether you're going to get sick from COVID, whether you can or can't take a medication because maybe it causes autism, what you can trust when your doctor says people die. People die as a result of cabinet secretaries and people playing cheap political games with the information that people rely on to make medical decisions. And so I am not usually one of the people that thinks that we can solve everything with a commission and oversight, but there is absolutely need for consequences and oversight in this instance. These are not political stunts, these are murders. People are dying right now because cabinet secretaries are turning cameras on, using the weapons of government, the reach of government, and telling people to make decisions that will make them sicker, that will make them less healthy, and will put their lives and their children's lives at risk. We need to bring accountability to every single person who spread this information, and we need to strengthen and pass laws so that political speakers, cabinet secretaries cannot be in this situation in the future. We should not allow, no matter if you're Senate confirmed or not, people to go up and on the megaphones and speak blatant lies that put people's lives at risk without criminal penalty.
Criminal penalties. So you envision a situation where people propagating this information, there should be criminal proceedings?
And I believe in a situation where people are knowingly propagating false information, especially from the megaphones of, for example, the HHS or government agencies, where they know they are informed, for example, by the very able scientists who work there, the people that I've worked with, tell them, vet their speeches, and say, if you say this, people are going to get sick. If you say this, we've modeled it. We know what the uptake will be of certain critical vaccines or preventative care or the types of actions that allow people to stay safe. And so they're making knowing decisions. If you can show that they've made a knowing decision to put people's lives at risk, then yes, they should be in jail.
Okay.
Abraham Lincoln said that you can fool some of the people some of the time, but you can't fool all the people all of the time. What I will say is this: misinformation has become a way of life for too many people. A lot of these folks lie. That's what they do. They lie. And it's applauded by people. They tell you taking Tylenol for a headache is bad. We all know that's not the truth. And so those of us who know the truth must speak the truth. Again, I go back to congressional hearings and congressional oversight. You expose them. And let me tell you, I believe there are more people in the middle in this country than there are those who are on the fringes of this country. And so we have to speak directly to the folks who are in the middle and try to pull those people who are on the fringes back to the middle. The reality of it is that truth always wins. You know, a lie cannot succeed. It can succeed for a moment because those of us who have a voice remain quiet. Look, it says that evil prospers when good people do nothing, when we sit on the sidelines. So we have to lift our voices to the debate, and we have to make sure that the truth gets out there, and that's what I'll do. Thank you.
I think this goes beyond just like subpoenas and oversight, because I agree those things are the things of the function of your congressional member, and whoever gets this seat should be ready to throw down in that way in Congress. But this goes on to a larger conversation that we need to have in the Democratic Party about how piss poor we are with messaging to people in the districts. We lost in November because Democrats stopped going to voters. This is very simple. There's no magic pill for this. The way that you build rapport and trust in community is that you have to be a part of community. And that is in grassroots organizing. So when we say we want to put a healthcare life expectancy task force together, or we say we want to build coalitions, that's us combating and fighting back against the disinformation and misinformation, because while we're in community, they're speaking their lies and we're talking to the folks in our community and speaking our truths. And so I think that this is a larger conversation that Democrats need to have about being better at both modernizing the way that we communicate with voters and getting better talking points to combat a lot of the lies and misinformation that comes out.
So, I want to take a bit of a different angle here on this. And I do agree. We got to hold those folks accountable. We got to make sure that people at the highest level of government are not propagating misinformation. It's dangerous, it's wrong, it's costing lives. But Oak Park, Proviso, Chicago, we all know that Donald Trump is a liar. We know that his cabinet secretary is a liar. This man stood at a podium during the pandemic and told us to drink bleach or Lysol or something like that. We know this man is a liar. However, what we're not talking about is the fact that as soon as he was elected, every single social media company went to the White House to kiss his ring. And when they did that, they rolled back fact checking on social media. Not all of our people know that this article on Facebook that looks very legitimate, it has a very legitimate name, it might even have a check mark next to it that was paid for. And you believe that it's actually real. And you believe that this article is saying that scientific research says that, as you said, you shouldn't take Tylenol for a headache. Every single one of those corporations, those social media companies that allow misinformation to be propagated on their sites and costing lives should be held accountable by the United States Congress.
Misinformation isn't new. People have always come into the emergency department with ideas about health that were given in best interest, but were not accurate. Dr. Google is a scourge. People come in with a problem and always are convinced by Google that it's cancer or worse. But when was that, or their misinformed cousin given them information, it was kind of easy to combat. You could say, well, where did you get that? And people say, you know, my cousin is sometimes wrong. He does have his car fix-it thing that's not always on point. But when it's coming from the top of government, or when an AI algorithm amplifies this misinformation to people who are already starting to spiral into confusion, it leads to what we just saw recently, where a woman followed an alkaline diet, leading to one child dying and 3 others being in the hospital, doing what she thought was right for her kids. We actually have to recognize that people who fall prey to misinformation are victims. And it requires that we use expertise and elevate expertise as leaders to find where is the best information and put them in front of the district. Whether or not that's ourselves, we're not all going to know everything about everything, but we have that expertise in this community, and we ought to be platforming that in order to combat this misinformation. Of course we need hearings. I cannot wait to call in RFK Jr. and grill him about why vaccines are safe and healthy and why we're not giving them. But that's different than what we need right here. That means we need people on this platform talking.
Thank you.
So Dr. King said, darkness cannot drive out darkness, only light can do that. And we have to be a society that the truth is the light. I'm happy to be from a state called Illinois, where we have a strong governor, a strong attorney general that have fought back on this type of misinformation. We have a department that needs to be empowered. That's the Illinois Department of Public Health. It's their job to make sure that they are giving out real information, good information as it relates to public health. The other necessary reform that we need is campaign finance reform to eliminate misinformation. It's important. You have people that's putting out misinformation and they're hiding behind dark money. That must be a part of our fight. And so I would also want to say that I congratulate the mayor on his work for the Juneteenth, but I passed a bill in Illinois. I also want to congratulate him on the work that he did for the train stations. I fought right along with them and passed it so that Forest Park will have the type of medical treatment for substance use disorder. So great job, Mayor.
Thank you. Okay, I'm gonna pivot to a few audience questions. We're gonna have the answers to these questions be a little bit shorter. We're gonna do 45 seconds, just so that we can get through another nice little stack here. I'm gonna start the first question down at the end with candidate Showalter. Can you share how perspectives from the disability community has and will continue to inform your policy positions around healthcare?
Yeah, absolutely. Sorry. Absolutely. I think the disability community is on the front lines of access to care, to both care and to payment for care. And it is one of the things that, when I say over and over again, we need to make sure that we are taking down the barriers of care. We say we need Medicare for all. We need to make sure that there are clinics that are close and accessible. These are the types of lessons that we have learned, because too often people with disabilities are on the front lines of the types of denials of care. Prove that you're disabled. File this paperwork to show that you're disabled. Make sure that you have both a doctor's note and a note from your employer to make sure that we are going to give you the coverage you deserve to meet your disability. These are the types of bureaucratic hurdles that make it impossible to do real care, and it's why we need universal programs.
Thank you. Everyone a chance to answer the audience questions.
I just couldn't help but think what you do unto the least of these, you'd also do unto God. And so I was privileged to serve on the Chicago Lighthouse for the Blind Board, people with visual impairment and blindness. They had the highest unemployment rate. 3/4 of them are unemployed. Well, we set up a program, an Illinois tollway program, to actually get them in the employment line. And so I'm proud to say that that program is working fine. A lot of the folks who answer that call, when they call you or communicate in terms of the iPass, those folks are visually impaired on the other end. So we're doing that work here. People who are with disabilities have to have dignity. We have to make sure they have access to health care, and I'll continue to fight to do that. Thank you.
Thank you.
I think that to include the disability community in this conversation of healthcare, we have to give them the autonomy that they are advocating for. And that starts with breaking down barriers in democracy. So I support accessible voting for them to participate in our democracy. Secondly, I think that we have to extend Medicaid, of course, and then at-home care and long-term care for those who are disabled. But if we're talking about a single-payer national health program, we have to make sure that those who have disabilities are at the table actually shaping the policy, so that we are not writing healthcare policy about them without them at the table. And I think that that starts both at the ballot box and giving them a voice and leadership in these coalitions, in these councils, and in the ability to write the legislation and shape it. Thank you.
Thank you.
For me, this goes back to coalition building. It goes back to recognizing that you're not always going to be the smartest person in the room, but your job is to organize and find the people that are, the people who are the experts. So I would lean on the disability community, as I already have. As a labor leader, it's not much that we do without checking in with Access Living First. I'll also tell you, in my role as a president of the Civilian Oversight Commission in Chicago, everything we do, we try to check in with the disability community. A good example of that is we're rewriting traffic stop policy, and we're approaching it through a lens of equity, that the police department should be pulling you over because one of your taillights is out and using it to profile you. And then somebody from the disability community, who I have a great relationship with, said, well, I want you to think about that because I'm visually impaired. Think about what that does to me. And that was a blind spot for me. I was thinking about it from justice and an equity lens, but that was a blind spot. That's why it's important to check in with the experts.
Thank you.
I have had a lot of interaction with Access Health over the years and care for folks with disabilities regularly, and one of the things they remind me is that ultimately all of us will experience disability in our lifetime. And so this is not a they issue, this is a we issue, and a couple of the things that they've taught me and have come to the top of the issues are, we have an SSI policy that people depend on that penalizes people for getting married, for making too much money, they lose benefits. Also, people who are best cared for at home use Medicaid benefits that often force them to spend away their assets in order to be able to be cared for at home. These are punitive and need to stop. These are policies that we can change on day one in the federal government. And my time's up.
I think Colin said, nothing for the community without the community. That's huge. One of the greatest parts about being elected, it is the greatest institution of learning. I mean, working in Spring for all these years, I have had the opportunity to learn and represent the people, the people's needs. And so I believe that that's the representative government that we need. And the doctor here talked about SSI. Many people don't know that people with disabilities will be under attack under the big whatever bill. So people that are using disability as an income, they're going to be under attack, and we have to fight back to protect people with disabilities for the only income that they have.
Every year, I spend time with the consumers of a place called the Progress Center for Persons with Disabilities. It's located in Forest Park. Today, I had lunch with someone from the Progress Center, and we talked about the work that they're doing. So my community has been responsive to persons with disabilities for as long as I've been serving. In Forest Park, we also support an organization called the West Suburban Special Recreation Association. We support Leiden Family Services. We have homes in Forest Park so that persons who have disabilities can live in dignity. I have a child with a very profound disability. The Forest Park schools could not care for my son, so we took him out and we sent him to a private school. So I think about the challenges of families who are caring for a disabled person all the time.
Thank you.
This next question, I'm actually going to start with Representative Ford, since I think this is applicable to your district. But what is your plan to keep community hospitals like West, South, and Loretto open and with enough resources to keep serving patients in the community?
The reimbursement rate is very important. The problem with the hospitals that deal with Medicaid patients is the reimbursement rate is too low. The parent mix has to be better, because what happens when you have big hospitals that have private insurance, they get a higher reimbursement rate, which allows for them to bring in more money. So we, one, have to make sure that we increase the reimbursement rate. We need to bring more money back to the safety net hospitals. Like I've done in this budget, you will see that we actually passed the budget to bring more money back to our safety nets. And we need to make sure that we do everything we can to protect preventive care so that people stay out of the emergency rooms. That's going to save taxpayers a lot of money.
Thank you.
I did have a follow-up question based on that. You were on the board formerly of Loretto. Can you talk about why you made the decision to step down?
Well, it was a decision that I had to make. It's a hospital that is very important to Oak Park and Austin. But there was a situation in that time during COVID that was unfortunate. And I, as a leader on that board, demanded the firing of the president or the CEO, and they refused to fire. So I couldn't stand being on the board with someone like that.
I'm going to just circle, keep going down the line of the question about supporting community hospitals like West Sub and Loretto and others in the district, and other FHQCs in the district.
It's simple. We need to fund the FQHCs. We need to fund the safety net hospitals, whether they're rural, whether they're urban. We need to make sure that they have the resources that they need to serve the most vulnerable communities, period.
Absolutely, we need to fund these hospitals, and especially the safety net hospitals. But I want to ask a question of why are these hospitals threatened in the first place? West Suburban is a great example. It has been bought and sold near a half dozen times in the last several years. And every time that a new private investor buys a hospital like that, What do? They load it with debt, they squeeze it for profits, they resell it. And that hospital is then left with a huge debt load to carry. They're not just paying to take care of patients, they are now trying to get out from under the debt that a previous investor who bought them for profits left them with. And so we need to make sure that aside from making sure that there is funding for these types of hospitals, we need to stop the private equity scourge of purchasing these types of hospitals and ban corporate ownership of hospitals in the first place.
I agree. I agree. And I think Marie hit on it, but the question that you really should ask is these hospitals like West Suburban, for 2 years in a row, leapfrog the rating agency for patient safety has given them an F in terms of patient safety. And so you have to ask yourself, do you want to go there? Would you send your loved one there? Or would you want to go somewhere that got an A in patient safety? So we got to hold these folks accountable. I mean, we can't just stand up and say, let's keep the doors open, and they get an F's in patient safety, because you wouldn't send your folks there. I wouldn't send my folks there. So that's my answer. Thanks.
I don't think it's any different. I think this is it's not a policy question, it's a moral question for the representative in the seat, and it's about advocating and fighting for those line items in the budget, right? If we're saying that our federal budget is a moral document, a moral living, breathing document, that we need to make sure that they're getting the funding. I don't think that this is rocket science. I think that this is an actual policy choice. So to answer the question earlier, why these CHCs are being treated like this, or safety net programs, is because it is a decision being made by our policymakers to not fund them. And so, I mean, I don't think I'm saying anything different from anybody up here. We need to fund them adequately and listen to the folks in the community about how we decrease wait times and get the ability for them to get access to healthcare.
Thank you.
So I agree, we have to improve reimbursement rates. We have to fight for stable funding for our safety net hospitals. But I actually want to talk about Loretto, because that's the hospital that our union represents. And that didn't happen by osmosis. And what the crisis that they're talking about is that the wealthy CEO of Loretto was taking vaccines from people in the community who was supposed to go to and giving it to his wealthy friends. Every person on that board hired that CEO. And I'm very glad that you did step down, but y'all hired him. Where was the oversight? That didn't happen by osmosis. We had to strike that hospital twice. During the pandemic, we had to be out there on the picket line, not just fighting for wages, but fighting for safe staffers. How the hell is it possible that you got one nurse taking care of 8, 9, 10 patients? How is that possible? We had to force that hospital to do what's right, and we're still trying to do it.
Safety net hospitals are always hanging by a thread, often with 7 days of cash on hand, often less, caring for people who rarely have other places to go, dependent on Medicaid, or people who don't have insurance at all. I sit on the board of a safety net provider, and as soon as we passed the budget bill in DC, we had to figure out how would we make ends meet. Well, it turns out there are a couple things you can do. One is, within that bill, there's a rural hospital fund that gives governors discretion on what is a rural hospital. West Sub is a rural hospital as far as I'm concerned. There is opportunity to use the funds within this bill to try to backstop, to improve 1115 waivers to ensure that people have the payments that go with them, and expand back to those people who don't have documentation to ensure that they get covered as well, because everybody deserves care.
Thank you.
Start back up at the beginning over here. The next audience question is, how will you ensure trans and gender non-conforming Americans get the life-saving, gender-affirming care that they need?
I said it earlier. I raise my hand, I support it. I want to make sure that everybody has access, including those who are in the transgender community. We shouldn't be discriminating against anybody. This is America, and we're one America, and we all have to come together. And we have to support our brothers and sisters who have chose that lifestyle. I mean, and we have to make sure that they have the necessary care and treatment, because if we don't, then something bad can happen to them, because they're gonna feel like they're ostracized or ignored, and it's too much suicide in that community already. So we have to bring suicide rates down. We have to make sure everybody has access.
Thank you.
Thank you.
So first off, I would say that trans folks don't choose a lifestyle, that's who they are.
Thank you.
And so just recognizing their humanity is the first step in that. And we do have to be careful with the language that we use, because when we talk about suicide rates, for example, that's not affirming who they are is a part of that. So we need to pass national civil rights, codifying that into law so that there isn't discriminatory practices happening. We need to train. So when we say we want Medicare for all, that means culturally competent healthcare, where doctors and nurses are trained and using pronouns and using the proper language and being trained up in the healthcare practices that need to happen. And then it's funding Medicaid and Medicare and making sure that protections are not being banned, to make sure the gender affirming of care actually happens.
The way that I will ensure that the trans community is protected is the same way I've been talking about every community, by censoring them. You are not going to hear me up here talking about I have all of the answers, because I will be lying to you. But what you will hear me say is that I will stand in solidarity every single time. And that doesn't mean that I co-opt an issue and I stand in front of you. It means I stand beside you or behind you. And we build a winning coalition. And we put the people who have experienced the most hurt at the forefront. And it looks like asking, how can I serve you? What do you need from me as a representative? What do you need from me as a partner? What do you need from me as a community member? And you take that feedback and you go at the issue together, just like every single other issue. It's not about myself, it is about us.
This comes right back to the notion that we all have this shared humanity. And when you care for one person, you care for all of us. Care for the trans community is just healthcare. It ought to be centered within Medicaid and Medicare. It ought to be delivered in ways that are reflective of individuals' needs and communities' needs, no different than any other care that we're providing. And I think this is one of the opportunities now that we've torn away so many things from the federal government, from offices of minority health, from civil rights divisions, that allow for us to restore and rebuild the sorts of services that are needed in this community.
Well, I would say this is one of those that I was in support of before it was popular. I voted to protect. This is a civil rights, and what would I do? You have to follow the science, follow the doctor's orders. That's what we have to do. It's as simple as that. Who are we to be in the room with a person? It's not our business, it's their right. And I want to make sure I address the fact about Loretto Hospital while I have a few seconds. I also stood with the unions every time they were out there at Loretto to protect the workers, and the credit must be given, because I stood with the workers every time to protect safety at Loretto Hospital.
Thank you.
In the community where I serve as a political leader, we've stood by our LGBTQ community. I mentioned earlier that the federal government is putting conditions on certain grants that they've awarded to Forest Park. One of those conditions is that we abide by any and all presidential orders. The president is attacking the transgender community. We're not going to sign on to that. We're not going to sell out our people for a few dollars. And so that's what I consider the principled approach that I bring to government. I stand with all the constituencies of the Forest Park, and we have to protect the dignity of all of our people.
Gender affirming care is healthcare, full stop. But more than that, part of the reason why one of the major risk factors amongst this part of the population is we have a system much larger than healthcare that doesn't recognize their dignity and freedom. We have we have a state system, for example, that does not allow people to put their appropriate pronouns on their passports anymore. In north of 30 states, it is legal to shoot a trans person because you are afraid of their sexuality, because you thought they were making sexual advances to you. And so this is broader than healthcare. This is a civil rights issue, and until we have a system and a government and a country that recognizes the basic dignity and freedom of every person to live their life as unencumbered as I do as a straight white man, we do not have justice.
Thank you all for such a robust and thoughtful responses. I thought I'd have more time for audience questions, but we are coming up on time. So we are going to move on to closing remarks. Each candidate will have 60 seconds to leave a concluding remark. And I will start with, I'll start with you, Kina, and we can work back down.
Thank you
Thank you so much, National Nurses United, PNHP, the People's Lobby. This was such important work at one point in my life, to be working with physicians and medical students, training them to fight for healthcare for everybody. And healthcare is literally everything. It's the air we breathe and the water we drink. And that was the impetus of me challenging an incumbent who was beloved across the district and entrenched for many years, was that although we had somebody who was co-sponsoring Medicare for all, he was also taking corporate PAC money. It's time. This is a once-in-a-generation opportunity for us to elect a progressive in this seat and to elect somebody who is not just going to vote the right way, but who is going to organize the right way for the people in the Illinois 7th Congressional District. Thank you. My name is Kina Collins.
I open this forum, and also thank you. Thank you to everyone out here who came to hear from us. But I'd like to start by saying, to close by saying, I open this forum by saying that I was a labor leader and a commission president. And that will always be who I am. But I also stepped down from both of those positions. And it's because I believe that we have to be willing to risk it all in this moment. Every single one of us. I'm proud of the coalition that this campaign is building, but I cannot do it without you. This is a worker-centered movement that is uniting the 7th District. There's a reason so many people are endorsing this campaign. Because it's not about me. This is about us. This is about centering the marginalized, the downtrodden, the forgotten about, the angry. This isn't about just beating Donald Trump. Some of our communities were struggling before he was president. He's in the way of justice. This is about justice. And we gotta go through him and his MAGA movement in order to get to justice. This is about giving people something to fight for and not against. That has been a problem with the Democratic Party, and that's what we're going to change together. Thank you.
It's a pleasure to be here tonight. I really appreciate everybody who came in, the conveners. I'm here because I'm so tired. I'm tired of going in the waiting room and having to choose who gets the next bed between somebody with cancer and a fever and a woman who is pregnant and bleeding. We deserve better. I can stop the bleeding of the trauma center, I can prescribe antibiotics, but I can't shape the policies from the emergency department that shape our lives. We deserve better. We need the sort of economy that honors our lives. We need a healthcare system that provides for us when we're vulnerable. And we need the weapons off the street that sends young people to me shredded. We need the sort of moral leadership that knows what's at stake and won't ever compromise away the things that allow for us all to flourish. Together we can create a society where we all flourish by design and not just simply limp along. I'm tired of being in an emergency department where I can't give people what they need. Let's do better together.
I'm running for Congress because I believe in our country. For a more perfect union. We know that our country has not been perfect, and we strive for a more perfect union. Our democracy is under attack. The work that has been done over the years, this administration is trying to roll it back, and not only trying, but is rolling back the voters' rights, rolling back health care, attacking human rights, attacking gender rights. I'm a fighter, and that's what I want to continue to do. As a progressive fighter, I would tell you, if you look at my track record, I have always been on the cutting edge of public policy to improve the district that I have represented for the last 18 years. And I hope you will vote for me, LaShawn Ford. You could go to fordforcongress.com. You could call me if you have anything that you'd like to talk about during this campaign. Thank you.
My name is Rory Hoskins. I serve as mayor of Forest Park. I serve as mayor of a community that used to not be a particularly welcoming community. Now Forest Park is a very diverse community. It celebrates inclusivity. We celebrate all of our constituencies. It's a place where people want to move to. Houses sell very quickly. Businesses want to come to Forest Park. I've never been a full-time politician. I'm an attorney. I'm a father of 4. I'm a former social worker. I've worked in economic development. I have a broad set of relationships. I'm prepared to effectively represent the 7th Congressional District, to build coalitions, and to engage the entire district. Never been a full-time politician. Thank you.
I'm Reed Showalter, and I'm running for Congress to make life more affordable. It's been unaffordable for a really long time, for crises that we've been facing for long before Donald Trump and crises that we'll be facing after Donald Trump. We need somebody in Congress who is going to take the generational chance to re-establish government for regular people, not for giant corporations, not for the people who are trying to get rich off the rest of us. And we have, as I said, a generational chance. There's a lot of things going wrong, but we are also building a ton of power. We are going to take back the House. We are going to take back the Senate. We are going to take back the presidency. And when we do, we need a leader from Chicago with the swagger of the city of big shoulders to actually lead on these fights. I'm going to fight for Medicare for all, and short of that, I'm going to fight for a Medicare buy-in when you have a shutdown. I won't cave on the 1-yard line. On every issue, you can count on me to stand up for regular people and never cave to corporate power.
I want to thank you all for hosting us tonight. I want to thank all of my colleagues and all of you all for coming. I'm Attorney Richard Boykin. We have 2 Americas, one for the wealthy, one for the poor. We have to bring America together. I've done it before on the county board. I've represented you well. I'm actually a resident of Oak Park and proud of it. But I've lived in Inglewood, grew up in Inglewood, lived in Austin. And so I've lived in every part of this district. And I know how to bring people together. And I know how to get things done in Washington. I worked as Chief of Staff to Congressman Danny Davis for the first 10 years of his 30-year career. I worked for Senator Carol Mosley Braun and Congressman Bobby Rush. Spent 13 years living, working in Washington. I will hit the ground running on day 1. I'm asking for your support. The district needs a lot of leadership, needs a lot of help, and I'm Richard Boykin, and I ask for your support. Thank you so much. God bless you.
Can we give one last round of applause for all of our candidates for being here today? And thank you to all of our volunteers who helped make this event come together. The candidates, some of them have information in the back if you're interested in reading it. The volunteers in the committee will be around to answer any last minute questions. Thank you all for being here.